Hi everyone, my name is Dr. Davis. I am a pediatric anesthesiologist here in San Antonio, Texas. And I'm going to speak to you today about my day-to-day operations for a pediatric anesthesiologist, as well as cover the salaries and also the educational requirements to become an anesthesiologist as well. So I'll start with how to become an anesthesiologist. Well, typically you will do 4 years of undergrad, and then you will take your MCAT, the same requirements usually for everyone interested in becoming a doctor, and then go into medical school. And then from medical school is where you really kind of decide where your interests lie. And the reason I chose anesthesiologist, I kind of didn't want to do rounding or clinical work, but I really like the day-to-day operations of the OR, and also anesthesiologists, aside from doing the anesthesia, we also do a significant number of procedures. So that's one of the main reasons that I chose the specialty. After medical school, we all do residency. So I went to residency at UT Southwestern in Dallas, Texas. And then from there, you kind of have subspecialties within anesthesiology. And they can range anywhere from cardiothoracic, you have pediatric anesthesiology, obstetrics as well. You have pain management, also regional. And regional is kind of like divided into two categories. There's the chronic pain portion, and then there's also the acute pain service. So obviously I chose pediatric anesthesiologist. I really enjoy working with kids. And so then I applied for fellowship because they do require additional training. And so I traveled to Boston Children's Hospital to complete a 1-year fellowship. And beyond there is a subspecialty within the subspecialty, which is called cardiac, peds cardiac anesthesiology, which requires an additional year of training. So in total for my training, I did 5 years, but if you want to do pediatric cards, then you have to do an additional year, which is a total of 6. So obviously this is a long trek. So I started out undergrad at Stanford, which is in California. And then I wasn't really unsure of what I wanted to do, and I thought I wanted to be a CEO of a hospital. So instead of getting an MBA, I got an MPH in Health Policy and Management at Emory. But while I was waiting to find a job, I started studying for the MCAT, and I did well enough, and I got into medical school. So I kind of changed interests along the way, and then I matriculated into Medical University of South Carolina, graduated from there, UT Southwestern, and then Boston, and then I landed my first job here with a private practice group in San Antonio, Texas. So not everyone goes into private practice directly out of training. Some of us actually go into academia. You can work at major freestanding children's hospitals. There are numerous across the country, or you can do a private practice group, which is where I am now. I really, really enjoy what I do every day. I mean, I still do adults sometimes, but my main concentration right now is pediatrics. And people are like, well, what is pediatrics anesthesia? It's like, the aha, duh moment. It's like anywhere from very, very critically ill, premature babies, all the way up until 18 years old is really where our specialties lie. Our training really, really comes into play when you start dealing with infants and children primarily under 12 months of age. The physiology is just very, very different when dealing with a baby versus an adult. There's a common misconception that children are just small adults, which is so far from the truth, which is why we require many, many hours of training particularly to work with that age group. So a typical day for me is kind of standard for most anesthesiologists. Usually my day actually starts the day before. So the day before you get your assignment for what you want to do, and so you start doing the chart review. I usually like to think of the anesthesiologist as the final safety stop. You've seen your surgeon or the procedure list who you need to see, and then we actually look over the chart. Because people have a misconception that you're just snoozing as if you're snoozing at home, and that's so far from the truth. We're managing hemodynamics. You may have some medical issues that require certain medications versus someone who may be completely healthy, so it really all depends. So that's the reason for our chart review. We're going over, I'm looking at trend of vitals, if you're in an inpatient setting, if you have any labs, I want to know if there's any blood disorders and electrolyte abnormalities. Sometimes, particularly with pediatric anesthesiologists, a lot of our kids have syndromes, and so you really have to kind of review that. And obviously you're not going to know everything, so you're still kind of a lifelong learner, and that really applies to anesthesiologists, because I will occasionally have to pull out my books and kind of review a syndrome just to make sure I'm not missing anything. So that's all but the night before. Then obviously you get to the hospital the day before, you get there quite early, You want to meet your patients, introduce yourself, establish a rapport with the patients, and also I need to set up my room and if the operation requires special equipment, then I obviously need to speak with my anesthesia techs and make sure I have that readily available in the OR. Then of course the patient rolls back to the OR. We start with induction, and those are usually kind of like the scariest moments with anesthesia for any case. It's kind of like takeoff, flying a plane, landing. So takeoff and landing are usually the more precarious situations, and then once the procedure starts, if it's a relatively healthy patient, I call that we're cruising at altitude at some point. Sometimes we have a little bit of bumps in the road during the intraoperative course that may require blood transfusions or addition of pressors. So communication with the surgeons is extremely important in that aspect. So we kind of work as a unit, we work as a team just to make sure the patient goes home and sees their family, and for us that's a very good day. So anesthesia salaries vary. If you're a generalist, I would say right now in the market's probably between $320 as much as $500. Again, it really depends on the market and your specialties. Some specialties are going to make a little bit more than others. I would say for pediatric anesthesiologists, I think the typical salary now is ranging between probably coming in about starting $400, and depends on where you practice and the type of practice, you can probably make as much as $500. It kind of depends on where you are. And also you have to remember how many years of training, experience matters, location also matters. Obviously, if you're in a large city with a lot of competition, you're not going to get paid as much as, say, when we're in a rural or more remote areas where there's a demand. So the supply and demand as far as economics still applies to anesthesiology and any field of medicine when it comes to that. Probably the most important advice I would say for you is to have an open mind going in. You want some sort of idea, so you're not flying in the wind, but primarily have an open mind. Try to get as much exposure as you can to every specialty, but primarily being proactive and reaching out to practitioners in the community just to kind of get feedback on what, the pros and cons and what they like about their specialty is very helpful, because you won't get exposed to everything in medical school or as a pre-med, so you have to be a little bit more proactive and kind of reaching out, sending emails, and you'll be surprised that people are very willing to help you. For students who are interested in anesthesiology or just medicine in general, I am on Instagram. You can request to add me. My IG handle is LDY Superfly. This is supposed to be Lady Superfly, but they wouldn't let me put the A, so that's how you can find me.